Hi, I'm Dr. Priya Bansal. I'm a board certified cosmetic plastic surgeon at RG Aesthetics. So today we are going to talk about breast reduction. Now breast reduction, what you understand by breast reduction in layman terms is a reduction in the size and volume of breast. But in scientific terms, we call it mammoplasty, reduction mammoplasty, because it is not only a reduction in size and volume by decreasing the gland, the fat and the skin, but it is an overall makeover of the breast, giving it a beautiful shape and a beautiful mound. Now in this era of celebrities, with boob size as big as F, one would think, why do we need a breast reduction? So breast reduction is basically indicated for patients who have very large saggy breasts, and this saggy breast leads to shoulder pain, neck or cervical pain and back pain because of bad stooping posture. In some patients, this excess weight, it causes an inability to exercise, inability to lead an active, healthy lifestyle because of the weight and discomfort from the heavy breasts. Sometimes there may be an asymmetry with one breast being larger than the other, and such patients may also require breast reduction. Because of the heavy hanging breast, some patients have intertrigo or fungal infections or rashes in the underbreast areas. Patients also face the difficulty, the discomfort from the grooving, which is caused because of the weight of the breast in the bra strap region. Besides, it may lead to social and sexual embarrassment, or it may lead to difficulty in finding a proper cloth fit. Now let us understand why this hypertrophy occurs. Well, in some patients, this might be a genetic deformity, whereas in some, it occurs during the pubertal phase where there is an inappropriate and improportionate increase in the size of breasts. This is called as virginal hypertrophy. For these patients who are suffering from virginal hypertrophy, a surgeon has to keep in mind that the growth phase should be stagnant for at least a year before he gives the patient the option of breast reduction. And the most common cause of breast hypertrophy is the changes associated during pregnancy and lactation. Another cause of breast hypertrophy can be generalized obesity. So what do we do in a breast reduction surgery? A breast reduction surgery is carried out under general anesthesia. We mark the incision around the nipple and areola so as to reduce the size of the nipple areola complex, which is most often increased in a patient of breast hypertrophy. Depending upon the size of the breasts or the amount of reduction required, we mark the pedicle of the breast to be preserved, which would make up the mount, the residual mount of the breast. So it can be a superior pedicle, it can be a superior medial pedicle, depending upon the surgeon preference and depending upon the breast size of the patient. The rest of the breast tissue is excised, and the remaining breast tissue, it is reshaped and it is remodeled to give the breast a beautiful conical shape. Sometimes in patients who desire a fuller upper pole, what we do is we preserve a small amount of tissue in the inferior pole and we tack it to the pectoralis fascia in the upper pole, giving the upper pole a more fuller, a more aesthetic appearance. So what do we achieve at the end of the procedure? We not only achieve a reduced breast size, but we also achieve a lifted and a more beautiful appearing breast, which is more rounded in shape, more fuller. The nipple areola complex is now smaller and more aesthetic looking, and the positioning of the entire breast is to a more aesthetic position. Now what about the scars? There's a scar around the nipple areola complex which is circular, and there's a vertical scar extending from the nipple areola complex to the inframammary line, that is the undersurface of the breast. So this can be either this lollipop shape, or in very huge breasts measuring about 1000 to 1500 grams, it can be extended into a J shape. This is the kind of scar which we at RG Aesthetics give. Now the circular scar around the areola, it is at the interface between dark and light pigmented skin. so it is not much visible. Whereas the vertical scar, although it extends from the nipple areola to the inferior inframammary line, this scar also fades over time and becomes almost inconspicuous. This is the beauty of breast, that the scars over breast heal and fade very nicely. At RG Aesthetics, we often combine the breast reduction procedure with liposuction of the upper lateral flanks and the axillary pad of fat. So this gives an overall good contour and it enhances the beauty of the breasts. Now coming to the recovery and downtime associated with this procedure. Breast reduction is often a daycare procedure and the patient is discharged either in the same evening or at the max next morning. She can carry out her normal routine activities after discharge. Antibiotic and analgesics are prescribed for a period of 5 days, which takes care of the minimal amount of discomfort which might be associated with the procedure. The patient is made to wear a compression garment or a sports bra for a period of 6 weeks, and overhead exercises or overhead weightlifting is to be avoided for a period of 6 weeks. The sutures applied are all absorbable and suture removal is not required. The patient is required to come for follow-up after 48 hours, then at 1 week, and then at 6 weeks. Swelling and bruising is often present, but the bruising subsides in about a period of 2 weeks. Swelling, it keeps on improving over a period of time, and the entire swelling takes about 6 months to disappear. Although the result is visible in the immediate post-op period, the result keeps on improving over a period of months as the swelling decreases and as the breast settles into a more normal position. So the final result is visible at a period of around 6 months.